I'm Jacqui Maguire. I'm a clinical psychologist and welcome to my bubble. Today in this video, we're going to look at how do humans respond to unplanned change, to uncertainty, to when life really kind of hits you blindsided. We're going to look at those emotions, how we potentially respond to those, and ways in which we can support others. And I suppose to start this discussion, well, there's no black and white answer. The way you have responded to COVID-19 or the people in your bubble might be very different to me and the people in mine. And that's because we're all unique as humans and we all have our own life stories and backgrounds and stresses that play into that. What I can say from what we know is that common responses to uncertainty and to scary situations are that people might be feeling worried or anxious because our brain doesn't deal very well with not knowing or not being able to foresee what's coming up in the future. I know that some people have been feeling more irritable or angry or frustrated lately. And again, you just think about the load that your brain is under processing all of this information that's coming through and all the micro decisions that you're now having to think about. For example, do I wipe the groceries before they go in the cupboard when they come home? That normally you wouldn't even pay 2 seconds thought to. So that kind of on edge or irritableness or grumpiness is also kind of really common and understood at the moment. People also potentially are feeling sad or at a bit of kind of a loss. All of those are normal and expected. I've also been speaking to people at the moment about, well, where does grief play a role in COVID-19 and level 4 lockdowns and kind of thinking about what the world will look like going forward. And I know we often reserve the conversation of grief to be around bereavement, but actually grief is more than just losing a loved one or losing a person. Grief is about loss in general. And when you think about our current situation right now, I think many people are experiencing a loss in the world as which we knew it. Our closed borders, meaning a loss to international travel, our isolation as a loss of liberty. And in response to that, people are having, I think, general grief reactions, whether it be anger, whether it be bargaining around if I wash my hands and stay physically distant, I won't get COVID-19. I think many people are sad, whether it's sad to not engage with family and friends or in their normal activities. The second part to grief, which I also think is prevalent in New Zealand at the moment, is what we would call anticipatory grief, which is we've kind of got this anxiety about what we're going to lose in the future. Again, coming back to that loss of access to the world or loss of trading or what happens to businesses, etc. Normally we speak about anticipatory grief. For example, if somebody gets a diagnosis of cancer and you start feeling that loss even when you hear that news. And in this case, it's just the same. So that feeling of overwhelm and anxiety can be absolutely part of anticipatory grief. So I suppose in terms of looking after your psychological well-being through this time, what we know in terms of regulating emotions is that it's really important to be able to notice what you're feeling and to label it. And some of us are really good at that, and others potentially haven't practiced it or haven't learned how to accurately label what you're feeling. So my advice to you in the upcoming weeks is, can you put some indicators around your environment? Maybe they're post-it notes on the wall or perhaps a reminder on your phone, that when you see that indicator or when you see that reminder, it gets you to check in with yourself and how you're feeling. Because that's how our brain starts to develop kind of a habit around emotional intelligence and emotional awareness. If you find it tricky labeling what you're actually feeling, go to Google an emotion list, print it out and stick it on your fridge. Because I betcha if it's hard to generate what you're feeling just from your brain, if you can look through a list, you'll probably find that it's much easier to accurately label what you're feeling. Once you've got good at labeling what you're feeling, which is the first step in this skill, the second is if those unpleasant emotions are really intense or they hit me blindsided or they feel really kind of hard and overwhelming, well, how do you turn them down? How do you regulate those? And there's a really useful acronym that psychologists use called ACE. And what that stands for, the A, is can you be aware of your emotions? And if you've done step 1, you would have been good at practicing that. The C is can you come into your body? So can you use your body to help ground you and make you present and take you away and distract you from those kind of unhelpful or unpleasant emotions? Ways in which you can do that is can you press your fingers firmly together and focus on that sensation? Can you dig your heels into the ground and divert all your attention just to focusing on that? Can you put your hands on the table and just notice the temperature? Can you sit up straight in your chair and elongate your posture? All of those things coming into your body kind of help distract your brain from those unhelpful, unpleasant emotions and give them time to kind of regulate and simmer down whilst you're diverting that attention. The E in ACE stands for come into your environment. Come into your everyday environment around you, and this is what we might normally call grounding. Can you use your senses to help give your brain a chance to calm down some of those emotions? Really, that just looks as simple as this. Can you name 5 things in the room around you? Can you name 5 things that you can touch, hear, smell, and taste? So, perhaps if you concentrate really hard, you'll be able to still notice the taste of your lunch on your tongue, for example. Or maybe you'll smell the flowers that are in the background. So that ACE, be aware of your emotions, come into your body, be aware of what's in your environment around you, is a really simple and easy way to start regulating those emotions. The question then is too about how do you know if the people around you or your loved ones are doing okay? How do you support them if perhaps you notice they're feeling overwhelmed or sad or withdrawn, etc.? And I think really the best way to do that is to check in and ask, how are you doing? And it sounds really easy when you're having a conversation with me like this. But we know that when people are in the moment and they're trying to engage in those conversations, that actually sometimes that can feel a bit scary for them, a bit overwhelming or a bit anxiety provoking. So I always get people to say, have a little internal plan for yourself. What do I want to ask this person? What am I worried about? And what do I want to get out of the conversation? And if you can kind of plan that, I've noticed that my partner seems pretty down and I'm worried about them. I want to check in and say, hey, are you doing okay? I'm here for you. And I want to follow up with the question of what's the best thing I can do to support you? Then if you've got that plan in your head, it helps you feel calmer when you go into that conversation. In my life, my way of checking in with people is by saying 1 to 10. 1 to 10, how are you doing? How are you going? 1 equals it's the worst I've ever felt, and 10 equals I'm on top of the world. And that gives you a good gauge to kind of check where people are at. If someone says to me, I don't know, I'm a 6 out of 10, my follow-up question as a loving friend or family member is, well, what would help you get to a 7? And that's a really useful way of checking in with people. I think as we go forward through this time, as we learn to grapple with our new world and our new surroundings, it's about holding compassion for other people and compassion for ourselves. And if you're kind of interacting with someone and they're not their usual selves at the moment, hold that compassion and remember the pre-COVID-19 version of that person you knew, because we're all responding differently. Our brains will all be in different levels of threat, and kind of compassion and care and gentleness will help get us through this time. See you later. Bye.